We think it's important that you see how your dollars are spent here at St. Mary's and how they may be spent in the future as we move toward the renovation of the OBGYN department. You're going to see some examples of patients' experiences here at St. Mary.
There's definitely the two words that come to my mind when I think about Dr. Snyder and his practice, as well as St. Mary and the NICU, labor delivery and the NICU are two things, compassion and passion. Without the two, I just don't see how we would have an opportunity to share this story today.
And we met 21 years ago at the age of 16 at a pediatric rehabilitation hospital in Philadelphia, Pennsylvania. Kevin was there with a stroke and I had had a spinal cord injury. After we left the hospital, we dated and were married in 2004. And a few years after we were married, we decided that we wanted to have children. So we needed to see various specialists to make sure that we could do it safely.
I would say at around 21 weeks, something just wasn't right. I wasn't feeling 100%, and I gave, as I did weeks prior, I gave a ring over to Dr. Snyder's office. And within a matter of minutes, I had a return call from Dr. Snyder advising me to go to labor and delivery.
We've had some significantly highly complex cases. You've met Galit Green, who had pulmonary embolus, ended up in the intensive care unit for a prolonged period of time.
When we arrived, and after we had an exam, it was known to us that I was going through preterm labor. And we were about 21 weeks, as I mentioned, and I believe the words there, it's still pretty, it sticks in my head, but they basically said your membranes are protruding and you're most likely going to be experiencing a miscarriage.
Once we realized that we were pregnant, we knew that we needed to go to, we needed to determine what hospital we wanted to have our son in. And so we felt pretty strongly about staying within the community because we knew that if I needed care, it was going to be urgent care and good care. And St. Mary's was a community hospital, so we knew that they had dealt with high-risk patients and I was going to be high risk. And I knew that they would be able to meet my needs, so we decided that St. Mary's was that hospital that we would have our son at.
When significant potential complications could ensue during her delivery, the hospital, all the physicians involved got together and devised a plan which worked flawlessly.
We told him that we had some concerns about one of my medical conditions, which is autonomic dysreflexia. So basically with autonomic dysreflexia, it's a sudden increase in your blood pressure and it can be life-threatening. So we just expressed our concerns and he had a plan of action for everything. If we were going to have issues with anything, and he addressed our concerns and he was wonderful.
At about 26 weeks, I started again having a preterm labor symptoms that required me to go in and be seen at the hospital again. At this time, Dr. Snyder met with me at labor and delivery and said we need to plan for the inevitable, but what we can do is to try to prolong it as far as we can, as long as we can.
There was a lot of communication during this very stressful time, and there was a lot of interaction with myself, which was important because I was sort of in shock going through this whole process. But I really appreciated as my lovely wife said, the options as well as a conveyance of the risks, as well as the ongoing communication.
Having this care plan was very helpful for us, knowing what we would need to prepare for in the inevitable that our daughter would arrive early.
We knew that there were going to be a critical care nurse available if need be. And also we had a team of nurses in the room just in case my blood pressure did skyrocket when we were about to give birth.
At 30 and a half weeks into the pregnancy, we rushed her over to the hospital, and the fact that we had a plan in place, Dr. Schneider decided that we would deliver the baby.
At that time, I wasn't even thinking that there's that possibility once I give birth that I would have to have he or she leave to go into the care of doctors and nurses. Once I gave birth to Aaliyah, we didn't hear any noises. The noise you usually think you're supposed to hear a healthy baby. So immediately my mind started racing and I was concerned. But in our doctor's calm voice, he said, "Don't you want to hold your daughter?" And there was probably nothing more we wanted to do at that time, at that moment, than to hold her.
And I ended up being induced just so they could have better control over the situation so that there wouldn't be any surprises. And then everything went fantastic, and we had Alex on May 30th, and he's healthy and happy, and everything went perfectly, thank God. So just very thankful for the care that we got at St. Mary's with all of the doctors, and the nurses were wonderful. And it was just nice being close to home and knowing that there's good care available, and we just had a very, very good experience at St. Mary's. So
because the NICU was so small, we were on a schedule as to when we can see our daughter. They try to accommodate us at any time, so even if it was just me wanting to, I had that urge to get to the hospital and see her, they had to respect, because of the privacy of other parents, that sometimes I'd have to wait some time until I was able to see her.
Currently, we do not have the space to accommodate the parents while we are working on a baby in the unit due to space constraints. However, in the new expanded unit, we will have independent pods with enough room for the parents to bond with their babies, even when we are working on another baby in the same unit.
I think I sort of knew Aaliyah was out of the woods when I saw the way she would just eat with an appetite like that. I just knew she was going to be okay.
As you see from these examples, the obstetric care at St. Mary is vitally important. We hope you were as touched by these stories as we were. We also sincerely thank these families for opening up and sharing this personal experience with us. It's so helpful for us to know and be reminded of how important our mission is. Thank you so much for your support throughout the years to St. Mary, and we thank you in advance for your continued support. Thank you for being with us.